Welcome to the Jewish Home Skill Documentation Training Series. Our topic is the Medicare Admission Note. At the end of this training, the participant should know: learn the minimum documentation requirements for Medicare Admission Note. Learn the importance of a skilled admission note. Learn impact of clinical documentation. The Medicare Admission Note is important because it identifies and summarizes the daily skilled services the patient needs after acute care hospitalization. The Medicare Admission Note is important because it communicates problems and treatment plan to achieve patient goals. The Medicare Note is the only proof for Medicare billing. Without it, facilities cannot bill Medicare for services rendered. The Medicare Part A Admission Note is one of the 4 important Medicare notes. It should be completed within 48 to 72 hours of admission. The Medicare Note is the responsibility of patient care coordinators and case managers. It is based on the findings of the interdisciplinary team assessments. Medicare defines skilled service as daily inpatient care that can only be delivered by a licensed nurse or rehabilitation professional. A skilled service is medically necessary, and there is evidence of clinical progress within a reasonable amount of time. Minimum documentation requirements for Medicare Admission Note. Time and date admitted. Age. Admitted for daily skilled services. Primary and secondary diagnosis. Pertinent medical history. Prior level of function. Discharge destination. List of daily nursing and/or rehabilitation assessments which relate to the primary diagnosis. List of other daily skilled needs which have been identified. Medicare Part A Admission Note Sample. Admitted on September 18, 2011 at 11 a.m. for daily skilled nursing and rehabilitation services. Patient is an 80-year-old woman admitted to UCSF following a 4-day hospital stay with a diagnosis of left femur fracture. Prior level of function was home with husband and independent for activities of daily living. Currently requires 2-person assist for transfers, ambulation and toileting. Physical therapy and occupational therapy to address functional limitations. Daily assessments of cardiovascular status, pain management, evaluate dangers of DVT and related complications after surgery. Discharge plan is home with husband. Medicare Readmission Note Sample. Patient readmitted on October 6, 2011 at 3 p.m. after being hospitalized for the second time with pneumonia. There is potential for the high reoccurrence due to an underlying condition of chronic obstructive pulmonary disease. Daily assessments of cardiovascular, respiratory status, and daily rehabilitation due to limited functional status. Medicare Part B Admission Note Sample. Patient is a long-term resident who was referred for speech therapy evaluation and treatment due to significant weight loss. Patient had 15% weight loss over the last 3 months. She has been receiving nutritional supplements and daily checks of her input and output. The nursing staff has sat with the resident at each meal, has begun to cough, choke and pocket her food. Speech therapy evaluated yesterday, and recommended swallowing treatment 3 times per week for 4 weeks. Other training sessions. Medicare Daily Note. Medicare Weekly Note. Weekly Part B Nursing Note. Medicare Discharge Note.